Right. Today is a very important day for our country. This is the nation's 77th Independence Day. I'm not going to wish you a happy Independence Day because every day we cherish the happiness of being independent. You will feel the difference when you are in India versus you are in any other country. Being a citizen of this country, it's of course the Constitution of India says a lot of responsibilities. As a physical therapist, our national professional representative body, the Indian Association of Physiotherapists, has also given what are the responsibilities and duties of a physical therapist. So these two are two distinct aspects. I as a citizen, what do I do for my country? And I as a physical therapist, what do I do for my profession? When you integrate both the things, it becomes what do I do for physical therapy so that India gets the identity in the world. And in the vision of the ruling government of India and of course the Honorable Prime Minister, where the Make in India initiative has been promoted and so many companies and startups have started conquering the world. Other nations are celebrating India's Independence Day. And globally, the India's image has definitely gone up to a level where we wanted it to be, or we want always it to be going higher and higher. In this present situation, physical therapy knowledge, of course, it has developed leaps and bounds in this wonderful country, where we have got a bachelor's degree program which has the content and the syllabus, the curriculum equivalent to a master's degree elsewhere in other countries. And at the same time, the master's degree program, which is like with specializations, cater to different types of patient populations. And the postgraduate or the post-MPT, the PhD, the Doctor of Philosophy, and also the Doctor of Physical Therapy programs, which is not yet fully introduced in India, but they also, of course, promote research. And research is something where we can innovatively and creatively evolve newer and newer techniques, newer treatment approaches, newer assessment validations. So I personally, on behalf of the Academy of Orthopedic Manual Physical Therapists, and of course together with our own beloved President Ritu Sani ma'am and our esteemed fellowship and core committee members, I am glad to wish you all every day filled with an independence from ignorance. Because it's not just independence which is from the British or the rule by a foreign country, it is to be independent from the knowledge that is foreign. Because a lot of people teach from different countries and they keep coming to India, they take courses. Of course, they are doing the good work in what they wanted to do. But many of the Indian physios, we feel that an Indian is teaching versus an overseas resource person is teaching. We always think that overseas resource person is the best. Okay? So that's, of course, it is there in every dimension of whatever we do. And we always think that the quality is better outside India. At least not in the intellectual part. Because we know Indians are leading the companies, even in the developed countries like USA. Many of the leading companies are headed by Indians. So Indians are known for the brains. And our tradition and our culture has bestowed so much that we can have unlimited potential to conquer the world through our intellect. So we should trust our instincts and see that, yes, of course, as a first beginner, we have to learn from someone. But once we are empowered, we are self-sufficient, we should be thinking of developing courses from ourselves. Indian population is so heterogeneous. We always proudly say unity in diversity. We have the maximum number of languages spoken for any country. We have the maximum differences in terms of the caste, culture, everything. But still, we are all united by just one spirit, that is, I am an Indian. That same, the thought should be there amongst all physical therapists. Do not think that I am Senthil. Think that I am an Indian. What I do reflects on the world, and they see me as an Indian physio. If you have this thought in your mind, you will automatically upgrade your standards to global excellence. Not just the excellence in terms of your income or the patient outcomes. The excellence has to be regarded as the best forever, for the future especially. Because futuristic knowledge is very, very important to be ahead of the rest of the professional community in also developing leadership in education, and most importantly, to keep in pace with the changes as we see this year. We also had a COVID. We are expecting many more pandemics to come. So we as healthcare professionals, we should be well adapted and also be prepared to combat every challenges, be it the offline method or online method of education. More than everything, remember, it's all about human beings, and the human body is such a wonderful gift of God. To make sure that we protect the nature, environment, respect every fellow living organisms, be it animals or plants, and ensure that our activities do not harm the planet. To conclude, I personally would like to invite all of you, not just the Indians, but even the whole world, to enroll into the courses of the AOMPT, which we have indigenously developed. Of course, the founding principles we have taken around 40% from the existing courses, from the information that is already existing, but we have evolved those courses into a pathomechanically applied, patient-centered, functional recovery oriented clinical approaches. We don't certify physical therapists on techniques. We certify physical therapists on their clinical approach. We believe in everyone having the capacity to develop newer and newer courses as per the demand of the clinical scenario. We don't believe in a protocol-based, prescriptive recipe treatments followed just because the guideline is giving that. No. There is always guidelines which tells that 1, 2, 3, 4, 5, 6, 7, 8 steps of how you approach the patient, you assess and you treat. And then at the end of it they say you have to individualize as per each and every patient. But how to individualize, that is the link. For example, I have a right shoulder pain and left shoulder pain. Is the shoulder pain same? If you think it is shoulder, then it is the same. But if you think of this as a human being, you know that this is dominant hand and this is non-dominant hand. This hand is useful for overhead activities, whereas this hand is useful for reaching behind the back activities, for self-care. So this itself makes multiple structures to be involved, right from challenging arterial system because it is elevated, scapular and glenohumeral muscle activity being more because against the gravity, and the mobility in terms of external rotation, which is important for the shoulder. Whereas the other side, it is a dependent position, it is a venous challenge. If you are keeping this position for a longer time, you will feel like heaviness of the hand. and you also have this internal rotation being happening, and muscles are towards the gravity where predominantly eccentric work will be needed. So remember that for every situation, even elbow, right side, we want the elbow flexion for functionally for feeding ourselves. Whereas the non-dominant hand elbow, we require the elbow extension to reach out to objects or to take support or to reach behind the back. So please understand the role, and even right hand and left hand also. Right hand we sign, we write it. We need intrinsic muscle activity more in the right hand compared to the left hand, which is more of power, forceful activities, not the fine, precise, gentler activities. So, gone are those days where you treat disorders, gone are those days where you treat structures. Because we have, for joints, we have techniques like Maitland, Mackenzie, Mulligan, manipulations, mobilizations, everything. But for muscles, we have these myofascial techniques. And for nerves, you have neural techniques. These are all structurally applied techniques. And we treat one after another. The patient will have joint with the muscle problem, with the nerve problem together, will come to you. You treat one by one, one after another. But in daily activity, they are not working one after another. They work together. So remember that functional treatments require multi-structural, simultaneously applied multi-structural techniques. And whenever the challenges are maximum, when you are doing an exercise, it is not like just you climb the wall, your exercise is over. No, your brain has to participate in that, which is called as the motor learning. And that is what makes the pain representation to get replaced with a functional representation, which is important for long-term recovery, because you don't treat the shoulder, you treat the brain, because the brain feels the shoulder is abnormal. The brain is the one which tells the body that shoulder is paining. Because even if shoulder not there, pain can come from the shoulder. We are aware of phantom limb pain. You are not pain therapist, you are not muscle therapist, you are not joint therapist, you are not nerve therapist, or you are not a coupling therapist, you are not a IASTM therapist, or you are a myofascial therapist, no, or a dry needling therapist, no, you are a physical therapist. So hats off to all the physical therapists who are doing a great work, realizing this functional orientation, enrolling into the best courses, and seeing the effect visibly on the patients in terms of long-term recovery right from day one. Because patient has difficulty in squatting, he comes to us with knee pain. We usually apply the electrotherapy or the exercise therapy, and after that the patient asks, can I squat? The therapist tells, do not squat for 1 week. He came with difficulty to squat, you are telling him not to squat. Is it a treatment? Patient has difficulty with forward bending, back pain. After applying all the treatments, you tell them not to bend. Is it a treatment? Rather, you train the forward bending itself on day one. That is the today's course where I am going to demonstrate in the clinical pathomechanics. Lumbar forward flexion, how pathomechanically it can be diagnosed and treated simultaneously. Because the moment we find something is aggravating, we can easily find what is relieving. Such is the beauty of pathomechanics. It's a clinical pathomechanics, that means assessment and treatment, both are there, integrating from history. That's the beauty of this course itself, and this is the world's first ever course on clinical pathomechanics provided by any organization in the history of physical therapy. And it's a 2 days course, full course with 25 free webinars daily that is happening on the Instagram. So physical therapists, please honestly and genuinely upgrade your knowledge, which reflects on the functional recovery. Muscle strength has improved, joint range of motion improved, Is the person's functional activity improved? That is important. That is the real improvement, for which I wish you all the very best and feel proud to be an Indian, and at the same time be responsible enough to realize, as an Indian, what did I do for my country as a physical therapist. If there is any disaster, go there, help everyone. I have seen one physio in Himachal, Dr. Anup Kumar sir. There is a lot of floods, landslides, and the cloudbursts have caused disaster. It is second time also it is now happening. As we speak, yesterday, today, people are suffering, they have lost their homes, cars are going in the water. But still, as a physio, I see that sir was helping everyone, the common people. That is where you are a real healthcare professional, because if you don't bother about the fellow human beings, how can you treat them? So disaster management is a very important factor which we all have to contribute to the society, which even our own Professor Dr. Ali Rani sir highlighted that, and he is a leading example for role of physical therapist in disaster management. He has done for the Gujarat earthquakes. So please understand how India has grown and how Indian physios are leading the world. Learn from an Indian so that your knowledge will be applicable to India when you treat your patients here. And also, don't just learn the procedures or the processes, learn how to actually develop techniques, so that will make you an independent clinician who can create newer and newer courses, newer and newer techniques beyond what is taught in the book or the videos. You should have the creativity for the problem solving and clinical decision making. Never allow that brain to get spoon feeding, and never think that technique is bigger than the therapist. Therapist is always the boss. You decide what combination of techniques have to be used on the patient. You are not doing a technique because the technique has to be done correctly. No. You are doing the technique because the patient has to improve. Good luck to you all, and of course, I close it with wishing you all for the best of the independence, not just today, but for the future, and independence from ignorance. See you all.